So total hip replacement surgery is a very successful procedure. I'd like to think that the majority of surgeons feel that they do a good job, but I think that we can always be better and more accurate in carrying out the surgery. So robotic-assisted surgery isn't me in one room or the robot does your surgery. It's actually just a robotic arm that helps me with particular software and planning prior to surgery to position the components in the most accurate position to improve soft tissue tension of the hip and to maximize the chances of getting equal leg lengths and tension, and therefore better outcome for the patient. So all hip surgery has a risk. The main risks that we always warn patients about would be infection, thrombosis, dislocation of the hip, and leg length discrepancy. So I think actually with robotic surgery, the risk of dislocation should be slightly less with more accurate placement of the components, and leg length discrepancy risk will also be less. So in answer, I think the risks are probably a little bit less with robotic surgery. So I would say that all patients are candidates for this type of operation. There's no difference in the type of implants that the surgeon uses. It's purely an aid to increase the accuracy and precision of the surgery. It may be particularly useful for patients with abnormal deformity or previous surgery, or those perhaps that have got a very stiff lumbar spine. But generally, any patient can have this. So hip replacement surgery has been around for many years. It started with Charnley back in the late 60s, early 70s. The real change has been the materials that are used and the fact that they last longer for younger patients. There have also been further developments with robotics and various other computer-assisted ways of helping the surgeon improve the accuracy of the procedure. So, as I said, hip replacement is a successful operation, but I think robot-assisted hip replacement has a couple of advantages. The first is that the planning is better. So each patient has a 3D CT scan prior to the operation, which means that the computer can work out exactly what sizes will be best for the patient. This theoretically should improve the accuracy, and it certainly seems to in my hands, to give perfect x-rays each time. With a good x-ray in terms of leg length and soft tissue tension, you would expect patients to recover quicker and get better strength in their abductor muscles quicker as well. So the recovery should be just as good, if not quicker.